Hi, I'm Lori Seibel, President and CEO of the Community Health Endowment of Lincoln. I'd like to welcome you to a series of community conversations about health equity. So what is the definition of health equity? According to the Robert Wood Johnson Foundation, it is that everyone has a just and fair opportunity to be as healthy as possible. And what could be a more timely conversation for us to have today than one about COVID? We are excited to share this opportunity for these conversations with the Lincoln-Lancaster County Health Department. And joining me today is Health Director Pat Lopez and Public Health Epidemiologist Raju Kakarapudi.
Thank you, Lori. Hello, I'm Raju Kakarapudi. I supervise the epidemiology team with the Lincoln-Lancaster County Health Department. As an epidemiologist, we watch for health trends locally, statewide, nationally, and from around the world. We analyze local data and compare with state and national data. We also provide data and analysis for decision makers to make a data-informed decision. Starting January 3rd, I, along with my epidemiology team, started monitoring events that are unfolding in Wuhan, China. Taking the lead from our health director, we started preparing plans and procedures for a potential pandemic. Having been at the health department in the past 20 years taught me that preparing plans and procedures in place well in advance. In the course of my career at the health department in the past 2 decades, we have been through multiple epidemics and a pandemic, namely SARS in 2003, West Nile virus in 2003, H1N1 pandemic in 2009, Zika in 2015-16, MERS in 2012, and Ebola in 2014. Every year, our epidemiology team deals with multiple local outbreaks that include foodborne disease outbreaks and other disease outbreaks. We continuously monitor the flu activity in our community. Though we have plans and procedures in place for most pandemics and epidemics, usually by the time it reaches Lincoln, or for that matter Nebraska, usually we have treatments in place, or in some cases even vaccines are available. But this pandemic is different. In addition to monitoring the continuous spread of the virus, we watched who was being most affected, especially the elderly, those with chronic health problems, minority populations, and those living in close quarters, and especially those who are economically disadvantaged. The first cases of this new novel coronavirus started appearing in Wuhan, China in third week of December to the first week of January. On January 3rd, China announced that they are seeing a new pathogen. The first case in the US was reported on Jan 22nd. The first case in Nebraska was reported on February 24th. And first case of COVID in Lancaster County was recorded on March 20th. So within 3 months, a virus already engulfed the world. In addition to monitoring the continuous spread of the virus, we watched who was being most affected, especially the elderly, those with chronic health problems, minority populations, and those living in close quarters, and especially those who are economically disadvantaged. As we were monitoring the spread of COVID-19 in the minority communities, by the end of May, locally, 32% of all our cases at that point in time were in our Asian community. Asian community makes only 4% of Lancaster County's population. Likewise, 24% of all cases by end of May was in Hispanic community, and Hispanic community makes up of only 7% of our population. And 8% of the cases were in African American community, and they make up about 4% of our county's population. In contrast, by end of May, 31% of the cases are in Caucasian population, and they make up of 81% of the population. As of now, 69% of the cases are in Caucasian population, while the Caucasian population makes up 81% of the population, and 31% of the cases are in minority populations, and they make up of 19% of our community's population. Seeing what's happening in East and West Coast helped us to prepare our preventive strategies for Lincoln and Lancaster County. Keeping the public informed about COVID-19 is crucial to prevention strategy. Apart from making data available through daily updates and through press conferences, we also wanted to communicate the risk of COVID to the community. The COVID risk dial was developed by Lincoln Lancaster County Health Department to help communicate the public the risk of spread of COVID-19 in Lancaster County. Since its inception in May, Lincoln Lancaster County Health Department has used 5 primary measures that can be described using current data to communicate the risk to the public. That is, positivity rate, cases, testing, contact tracing, and healthcare system capacity. The Lincoln and Lancaster County Health Department has continuously monitored the measures and metrics that is used for the risk dial that can be applied practically for our local jurisdiction.
Thank you, Raju. Today, in addition to what Raju shared, I'd like to give you a little bit more information about our local public health response to the pandemic. You know, as you may already know, the health department is responsible to investigate and monitor reportable diseases in our community. We monitor this activity on a daily basis and project where additional resources may be needed or further investigations are important for us to carry out. As you know, prevention is our primary goal, but we also want to mitigate or respond quickly to prevent the advancement of any outbreak situations in the community. What we really learned during this pandemic is it's really shone the light very brightly on the health inequities we have. We know that elderly were adversely impacted. We know that those with chronic conditions, those living in close conditions, and our ethnic and minority populations were very adversely impacted. Lincoln did what it always does in a crisis. We came together with public health, our schools, our healthcare systems, our local government, our elder care, long-term care, our cultural center leaders, our faith leaders, and our business community, and developed a coordinated response. This also involved our local fire, police, law, and multiple other county and city agencies in developing a response for Lincoln. What we learned early on in May, I think many of you heard, that our food processing plants had many individuals who were ill. Even though we had a plan in Crete, we also had meat processing plants in Lincoln. And many family members worked both at Crete and in Lincoln at facilities. There were different responses from the different facilities about how to control and mitigate the outbreak. We were able to provide much assistance, but we also saw the detrimental impact that this had on families with their ability to live, pay their rent, get their food. When you're in isolation or in quarantine, that means you can't leave where you're at. That means that your children are there being exposed. That means that even getting things for your basic needs are impacted. One of the things that we did here was develop isolation packages for families and assisted them getting the necessary things they needed, such as food and other items for their healthcare needs. We also worked with our homeless community. We moved several men from the men's shelter to decrease density to a different location, and we found a location for over 50 women and children in a hotel here in Lincoln. I'm happy to say many of those women and children now have permanent housing and are further going on with their lives in a positive way. The other thing that we've worked with is our urban development area and our homeless coalition to assist people with rent, mortgage, and utility assistance. This has been a major effort from our urban development area, and many of you have seen some of the resources available on the web page. We also worked with families with child care centers and looked for funding for them and made them aware. Our child care centers were also adversely impacted because many people were working remotely from home or they'd had their hours decreased. So we worked with them to provide the assistance that they could offer for our families. I think one of the biggest things too that people don't understand is when we identify a reportable disease, and especially with COVID, we actually do disease investigation, and that means we have close to almost 50 of our public health nurses or those we have contracted with to reach out and assist families. And not only do they assist them in that way, but they also provide access to resources the family may need that they're not aware of, whether it be health care or food or housing and utility assistance. We developed a separate line for people to call in that had questions about COVID concerns. We've established our website, and we're happy to share some of the information that we have in a very transparent way with the community about who's being impacted and how they're being impacted. I think the biggest thing that we've learned from this pandemic is our need as a community to really address our health equity issues and how we can do that. And some of the resources we brought to bear could be great resources for us to consider in the future as we look at policy development and access to help people improve the way they live their daily lives and prevent their illness and allow our children to be back in school and our businesses open. So I'll leave with a public health message from the health director. Wear a mask, wash your hands, and watch your distance.
So why has COVID impacted minority populations in our community more than others? While Pat and Raju have reviewed some of those reasons, ranging from occupations to testing availability, this may be a question that we will be trying to answer for years to come. One thing we do know is that a pandemic offers an X-ray on society. It allows us to see all of the broken places. And health disparities is certainly one of those broken places. And one of the key drivers to health disparities is poverty. Poverty is often referred to as the cause of causes, and for good reason. Once it's embedded in a community, we know that poverty simply causes a lot of things to go wrong for people, for families, for neighborhoods. So, if we know that COVID has impacted our minority population differently in Lincoln, what do we know about these populations and how they're impacted by poverty? Our poverty rate in Lincoln, Nebraska is 13.1%. That means for every 100 Lincolnites, 13 of them live below the poverty line. And that's about $25,000 for a family of 4. This map of Lincoln tells us in blue where more than 13.1% of people live in poverty. We also know that about 18.4% of our community is non-white. And this map tells us in pink where the percentage of non-white population is above our community average. So what will happen when we lay these maps on top of each other? I think we discover something powerful. We find out that of the 31 census tracts with above average minority population, 80% also have a higher than average poverty rate. And of the 39 census tracts with below average minority population, only 18% have an above average poverty rate. This tells us that being a minority and living in poverty in Lincoln are correlated. Let's go a little bit deeper. What if we double everything? These are the census tracts that currently bear the highest concentrations of minority individuals and poverty, both double the rate of both of those. If in fact poverty is the cause of causes, I think it's fair to say that poverty plays a role in health inequities in our community, even health inequities that are related to a global pandemic. There is no clearer correlation to health inequities and poverty than this map. Life expectancy is correlated with poverty. In fact, some of the highest poverty areas in Lincoln have a 20-year lower life expectancy than others. So the question is, what are we going to do next? I think there's several things I would call upon the community to do. One is to be willing to have difficult conversations. We all know that this isn't an easy subject, and it's one that's going to take a lot of people willing to come to the table. It means that we have to work to lift the weight of poverty that is occurring in some neighborhoods more than others. We have to be willing to embrace brain science, that which tells us that children between the ages of 0 and 3 are most impacted by the adverse effects of living in poverty. And we have to recognize that this is both a public and a private response. We can't expect the government to solve all of the problems, and there has to be a unified approach to making a difference. And finally, I would call on all of us to have a willingness to act, to change the way our community looks today in order to reach health equity for all. So we've been able to share with you data and policy and public health perspectives, but what about the stories of people who have been individually impacted by COVID? What would they have to say about how this disease has impacted their lives and through their perspectives as members of our community? We're grateful that they have decided to share their stories with you today.
Hi, my name is Tariana. I work at a childcare center and I'm a single mother. Working at a childcare center, I have seen families struggle and I have seen children being pulled out of the daycare because their parents cannot afford it. It affects everybody, emotionally, physically. Being a parent alone is very hard, but also being a parent during COVID, I feel like is a struggle and is just a barrier and heavy on your shoulders. I am scared to go out. I read all these stories about how babies are getting COVID, how a lot of elderly people are getting COVID, and it just scares me to go out to a store just in case my baby gets it. I wouldn't know what to do. I would not be able to afford medical bills if he did get it. I haven't been able to go hang out with my family members like I used to. I can't hang out with friends like I want to because I have to protect my son from this virus. And the Malone Center has really helped with bringing me diapers instead of me having to go out to the store and getting it. They connect with you on an emotional level too, so it is one big family here. You're not just singled out. You're not just one person. You're not on your own. You have people to help you that want to help you. The support does look different from before COVID-19, but they're working 10 times harder because of this virus. They're working harder to provide for you. They're working harder to make sure that you have what you need during this crisis. When everybody comes together, you can make a difference and you can make this world a really good place, a really good, healthy, better place for your children, for everybody, for the whole community.
Hello, my name is Lisandra Jorge from El Centro de las Americas. I am community health worker here in El Centro, and today we'll talk with José López, who was affected by COVID-19. Hola comunidad, mi nombre es Lisandra del Centro de las Américas. Yo soy trabajadora comunitaria y hoy vamos a estar hablando con José, quien fue afectado por el COVID-19.
El síntoma que sentí el primer día fue fiebre, problemas para respirar y dolor de cabeza, dolor de cuerpo fueron los primeros síntomas.
So my first symptom was fever and pain in all my body.
De ahí me quedé con fiebre, dolor de cabeza, dolor de las gargantas y la respiración se me normalizó. no tuve necesidad de ir al hospital.
¿Cuánto tiempo estuvo con los síntomas?
Tuve 2 semanas y también perdí el gusto, el olfato y el apetito de comer. Durante 2 semanas pasé en eso.
So during 2 weeks, Jose was with body pain, with he lost the smell, and also he was in bed during those weeks. ¿Cuándo fue al hospital?
No fui al hospital. Ya tenía 2 semanas de estar yo enfermo. No trabajaba porque la enfermedad no sabía qué tenía. Se me enfermó mi hijo. Yo lo que hice, saqué una cita con el doctor de mi hijo, le hicieron el examen y los pusieron en cuarentena del momento que mi hijo está enfermo, ya una temperatura más de 100.
So after 2 weeks, the Jose's son was sick too with the same symptoms, and so he went to the hospital with the son. The son was tested and he was positive by COVID. Todo el COVID a su familia en cuanto a economía. So how did COVID affect your family?
Sí, me afectó porque económicamente, porque no estaba trabajando.
So Jose lost the job in that moment because the COVID.
Pasé 6 semanas sin trabajar.
He was 6 weeks in the house, not working at all.
Después de las 2 semanas delante, se me calmaron las fiebres. Ya no era permanente las fiebres, pero tenía el problema de la tos, dolor de espaldas.
After 2 weeks, the fever go down, but he was with back pain. Como usted tiene diabetes, usted es un paciente diabético, ¿cuál era su temor? So, Jose is a diabetic patient.
Tuve temor por tener la diabetes. En ese momento estaba pasando por una crisis.
So Jose was very scary about the diabetic condition. In that moment, he was with a crisis with the diabetic.
Y tuve miedo porque con el coronavirus pensé que me iba a agravar demasiado.
So he was very scary.
Pero gracias a Dios no pasó mucho más peor las cosas. Y digamos, las medicinas que no tomé, lo único que tomaba era té de manzanilla con limón y eso era lo que cosas calientes tomaba. Tengo más precaución por ser diabético con esto del COVID. Tengo que tener más cuidado en todo por no volverme a contagiar.
So after COVID, Jose is taking care his health much better than in the past because he knows how important it is being healthy. Thank you so much, Jose, por la conversación.
Gracias a ustedes por darme la oportunidad de estar aquí.
Hello, my name is Richard. I've lived in Lincoln, Nebraska 20-some odd years. It's a nice place to live, but I know right now we're dealing with some situations that have people in a strain, including myself, but just have to take life now, a day at a time. My advice is because of the older people, they should be given top priority when it comes to this COVID virus. They're elderly, their immune system is weakened because of their age or them being ill. I myself, I don't go out much. I'm a homebody. I could stay in, read, listen to jazz. Every now and then I might go out to the store or whatever and I see people without a mask and it kind of upsets me, you know, because I know they're supposed to have a mask on, but some people are just hard-headed and some people are not taking this seriously enough to take care of themselves or their families. Because it's a disease, it doesn't take too much time for it to spread. This thing is spreading like wildfire. It's all over the whole earth right now, except the North Pole. And who wants to go to the North Pole to run away? Nobody, I don't believe. People are really having problems. Some people are having really bad problems. Sometimes I'll go by the gathering place or Matt Talbot, and each time I go by there, there's more and more people there without food. But you have those organizations that take care of some people and do what they can to help them survive. Situations come up in everybody's life that are kind of hard to deal with. That's why we need to be closer to one another and talk and relate our situations on what we think we should do to help others, especially the elderly and especially the young as well, because this thing is running through the teenagers pretty bad, and it's not going to slow down. Do the right thing and try your best to help as many as you can. Yeah, Asian partners have been a real big help in my life. They deliver me meals. I can speak with them on various issues, insurance issues, whatever issues that I have that I need to talk with somebody with. I can speak with them at Asian Partners. I enjoy the artwork from the kids. I may have 30 or 45 papers of artwork from the kids. It warms my heart when I look at it. Because some of it is funny and some of it is very interesting. To all those people down at Asian Partners and the people that are here with me today interviewing me, my heart goes out to them both, and I'm very appreciative of Mike and Paula. And you get that?
I'm Tiffany.
I'm Shaylin.
This is little Mikey, and this is April. Thursday morning, my husband woke up with the fever. So did my little boy. And I just felt like I was sinuses. So me and my husband tested. Not really knowing how you test and where you test was confusing, but we managed to figure it out. Me and my husband were positive. Our kids had to extra quarantine because their doctor didn't want to test them because there's nothing that she could have done anyway.
And just being stuck with the family 24/7. You know, it's nice to just have some space and like go other places with friends, but you can't do that on quarantine.
So I had to take the original, 14 days off. It's still hard, you expect to go back to work. I do work overtime and I kind of depend on that. So not having that really hurt. On top of my husband not working, which that's no income. It sucks. For somebody that works paycheck to paycheck, the stress of the mom comes into play of, okay, well, now that we're quarantined, what about those weeks that, the hubby doesn't have a paycheck? Or what are we going to do for that gap? And then he's got to work another 2 weeks before he can even get a paycheck, so that's a whole month without a paycheck. It's stressful. I definitely give the shout out to the community. When we weren't sure of that following food and how bills were going to get paid, with my husband not having a paycheck, Charlotte, through the health department, had put me in God's way of Tom with the Good Neighbor Center. He brought us food every week. And he's been there, and I am absolutely grateful for the Good Neighbor Center and him making sure that we have what we need during this hard time. So what I'd like everybody to take serious is wearing a mask, staying your 6 feet, sanitizing your hands, washing when you can. Just these small little guidelines need to be followed. They're there for a reason. It's like a tornado. it might hit you and it won't hit the next person. It hits what it wants to. You know, I couldn't even touch my husband when he had the virus because it hurt him so bad. You know, I felt like my head was going to explode. And if we could prevent that, why aren't we doing that? So we can prevent maybe one person dying. Why aren't we trying to take those precautions? Because it's that simple to do that. This is insane that people aren't following those protocols that are put in place, and they're put in place for a reason.
And they're so easy to just follow.
And they're so easy to just follow. Well said. If my child can, why can't an adult?
It's impacted me a lot, just seeing my dad always on the bed and in pain. I mean, it's impacted my mom because she was on her feet 24/7. And I've battled depression most of my life, and this corona quarantine stuff hasn't helped at all. It's infected me to where I was going suicidal. All you have to do is just to go out to tell somebody what you're going through and how you're feeling, and it's helped me through it. And I'm here today with my mama, still alive, and my dad is still alive, and I'm grateful to be alive. And it's me telling them what happened and them helping me through it. Take this serious, very serious, because most of you guys could die from this. And it's scary to know that your loved one's hurting and in pain. Good job.
My name is Nyaboy. I am a community advocate here at the Asian Community and Culture Center. When the COVID-19 started, getting clients to get tested was really tough for us to educate them, because they didn't trust the testings really well, because some of them you may have no symptoms at all, and then your test will come out positive. And some of the clients would have symptoms and their test will come out negative. So for that, it's a cure for them, that thinking maybe there's something going on that testing. Before they didn't kind of take it serious. There wasn't a lot of isolations for themselves. When one person get infected, they were still going door to door or visiting clients, or not even able to get tested. But after they know that it hit a lot of families, and they had seen families member that are dying at the hospitals, that it just make them scared. Yeah, it just make a big U-turn to be able to know, to be able to say, oh, okay, this is real, we have to do something. So each person has started to take control on themselves. I have to protect my family. And that's when it start to get a slow down, because when it comes to your family, then you have to do something. As COVID started, we have seen a lot of clients that are struggling with the health, and also struggling with a lot of issues like pay bills, because most of them, they lost house. We have seen clients that lost their job because they have family members that affected with COVID and make them to stay at the hospital for long times. We have seen a lot of clients that lost their job because they have a little kids that need to stay home when the school closed. Since COVID-19, we're trying to make everything to be on Zoom, but it was challenging because those people, they never own a computers. They don't know how to use technology. For them to be able to educate, it was so hard. Even for them to understand when you go to the doctor's appointment that maybe you just have to bring one person that has an appointment when you have more kids or extra family that has nowhere to go. I have recently worked with with the single moms with 5 kids, and because she lost her job due to staying home with the kid to help them with schools, and she even lost her car because she couldn't able to keep paying that car. And at this time, I'm working with her, trying to make her where she at, like finding a car or finding a job, and to be able to continue as she was able to help herself. So please try to understand for the people that going through the tough. Those people, they have kids, they have families, and the life right now is so difficult for them. If there's any way that they can get help, so please help those people. They need help in so many different ways. They stress out. They need help with a mental challenge. They need help with the bills. They need help in a lot of ways. These people need help. So please try to reach out. If you have anything to help those people, it would be great, so we can work as a one big family.
Are we ready to go with the follow-up part? There we are. Hello, everybody. Thank you so much for joining us and being part of this conversation today. I think that the stories were powerful. I mean, we can provide information, we can provide data, we can talk from a public health perspective, but it's really hearing the powerful stories of individuals who've been directly affected, whether it be through the actual disease, the disease of someone around them, or being fearful of the disease or the lasting effects that it might have on things like mental health. There's some powerful stories, and so thank you to those folks who provided those stories to you, but thank you for listening to them. I want to remind you all that this isn't a webinar format, and so you all are muted, but we would ask you to put any questions that you have for Pat or Raju or me into the chat, and we can try to answer those the best we can. And so please go ahead and type those in, and we'll make sure to do that. I do want to start with a question, however, and that is for Pat specifically. And Pat's been, first of all, thank you, Pat, for everything you've done for the last months. As you, I know, were never expecting to lead this incredible effort in our community, but you've done it so well. The question is, even since the time that we've put together this program, I mean, it hasn't been but just days since we've all been recording our parts of this, but things have changed again. We moved into that red zone, something we never thought that we were going to be doing, and we've all been trying. I think we've seen more and more people trying to make an impact on this disease, but what else can we do? What are the top things that you can tell the community to do right now as we've entered this new phase of the pandemic?
Well, I think the most important things are for people to be able to stay at home as much as possible and to really only go out for work, school, or medical appointments, or to get items you really need for your essential health at home. It's really challenging right now with the holiday coming up, Thanksgiving. I was looking really forward to being with my family. But this year, we just have to do things differently in order to make sure we keep ourselves safe and our family members safe in our community. Even since last Friday, we've seen, when we announced that we were going into red, we've seen an increase in our number of cases in the community, and also an increase in the number of hospitalizations. So we're really at a critical point now. We really want to work hard to get our numbers back down and to bend that curve in the right direction and really flatten it as much as possible. We've done it as a community before, and I know we can again. And what's really important is that we're able to keep our children in school, which we all know that's the best place for them, not only for their education, but for their social and emotional health. And we're keeping our businesses open so people are able to work. You know, another thing we're asking people to do as much as possible, if you're working in an organization that can allow you to telework if your job allows you to do that. That's a great option as well. But most importantly, wear your mask, wash your hands, and watch your distance.
Well, speaking of masks, not everybody feels the same way about masks. And in fact, Lincoln is one of the few places that has mandated the use of those. How difficult is it to deal with just differing perspectives on masks, not only within the community, but with the different mandates across the state?
It's really challenging because the individuals across the state outside of Omaha and Lincoln that don't have a mask mandate frequently come into our communities, and they're also, at risk and putting our community at risk. We do a lot of work with our other local health departments across the state. You should know that all schools use the encouragement to have students wear masks, and I'm happy to say the greatest majority of them do, because we found out that when students wear masks in school, they stay in school, and that's a really important lesson that we've learned. Also, we have tremendous community support for wearing masks, and there is additional information out there. And I'd like to point out, yesterday, the governor issued a new directed health measure that requires masks in several areas.
So we're moving that direction. Well, I want to get back to the real meat of our discussion, which is about health equity. And can you talk about specifically related to the higher incident of cases among some minority populations? What do you think is really driving that? And we do have a question about whether or not healthcare access in different neighborhoods is part of that equation as well. But what are really at the root of that? I talked about poverty in my comments, but can you be more specific about some of the things that are causing a higher number of cases in our minority population?
Sure, I'll start, and I may ask Raju to add in there with me. But one of the things that we do know is, you've talked about poverty, but we also know that many of our families work in environments that they may not have paid sick leave. They may not be able to stay at home because they risk losing their job. They may have other extended family that they're taking care of. And I think in looking at the conditions that many people have been working in because of their lower paying jobs or the type of work they're doing has really put them at risk. Also, we found that many people don't have health insurance, or that there were barriers for people being able to access testing. So we did a lot of interpretation of material or translation of materials. We also set up testing sites that were much more comfortable for people to come to, maybe located closer to their own neighborhoods, and use community members that were trusted members and respected to get people in to have them do testing. That's just some of the things that we saw. In addition, I think you heard some of the individuals talking about the problem was when school wasn't there. Can you just imagine if your job, you can't work from home and you have no sick leave or paid type of leave, but yet your children are home and they need to learn remotely, and the very challenges just that in and of itself makes.
Yeah, very good point. So we do see that the number of cases of COVID or the differences in terms of the proportions are lessening. It's not as out of proportion for the minority populations as it was early on. Can you, do you think disparity is still an issue in COVID? Do you think that health inequities still exist?
So, yeah, I still think it does, Laurie. And I mean, the thing is, yes, we do see some, like burden of disease, like say as a proportion of cases in the minority community is completely different than what we were seeing in May. But still, out of 19% of the minority population in Lancaster County, 31% of our cases are in minority populations. Still, with about 10,000 or 11,000 cases we have, 31% of them still makes 3,000 cases in the minority population. And as you mentioned in your comments, Laurie, the health disparities impact the burden of disease differently when you add poverty and a lot of other things to this scenario. And one of the things that we noticed when we first started investigating cases was a lot of minority population, they have a multi-generational households. And in a sense that, yes, we ask them to isolate, but when you're living in a multi-generational households, it's very difficult to isolate or quarantine. That also adds pressure to the spread of disease too. So.
Yeah, very good. We have a question about the young woman in the video who mentioned that there had been a significant impact on her mental health. And we're hearing more and more about that. At the Community Health Endowment, we received a number of requests for funding of mental health programs, far more than we usually do. And we can't help but think that's related to the current circumstances. So, do you think that there is a difference in the mental health situation? Is it growing? Is it having a greater impact perhaps on the minority community or the cultural groups than others? Do you have any thoughts on the mental health public health part of this?
I think we're seeing that in multiple different groups just because of the isolation that's gone on and people that's why school is so important for our young people, to be able to get back to school and be in that classroom where they have those other supports available to them, even outside of the education process. But we are seeing a great deal more of that, and we are providing resources as far as getting people connected with services they might need. And as you can imagine, if you're in a situation where your family's lost their income and you're feeling the stress of your parents, you can tell that they aren't able to really buy the food that's needed, or there's concern about being able to pay for rent or where you're going to live. It really impacts our children and adults a great deal. So yes, we have seen, I think the pandemic has really brought to light some of that, especially when you don't have the same resources as maybe others who aren't living in poverty to accomplish what you need to do.
I think it's, I've heard from the Lincoln Police Department that they've received significantly more calls related to mental health concerns during this pandemic, and as well as concerns from the frontline law enforcement folks who are having to walk into circumstances where perhaps they'll be exposed as well. So mental health concerns both inside and outside of our law enforcement community, I think is one of those one of those markers that we can use to say that the mental health concerns are rising. One of the things that I've also heard that organizations have done, which I give all credit to nonprofits who've had to pivot so much in this situation, moving to things like telehealth, telecounseling, being able to get their services out to people who need them in a very innovative way. We've seen programming from organizations like the Bay being able to put their services online and still meet the needs of kind of high-risk teens during this period. So we've been really impressed with how the nonprofit community, the medical community, the behavioral health community has been able to step up and solve this issue in a new way. I think I also am fascinated to hear about what you think, and I hate to put you on the spot, Pat, I didn't tell you I was going to ask this question, but what about this new vaccine, and what do you think is going to happen? And going back to the health equity issue, how do we make sure that people who are most impacted, those people of color, the elderly, that they're going to feel comfortable getting the vaccine, they're going to know where to get the vaccine, they're going to really be able to have it presented to them in a way that perhaps, if English isn't their first language, how are we going to really make them feel comfortable about what may be a good option for a lot of people?
That's a great question, Lori. And we put together a group of physicians in the community, as well as representatives from the elder community and others to look at the vaccine. And we're specifically talking to, we'll be doing some focus meetings with different cultural groups and ethnicity groups in the community and lower income individuals who may not have access, to find out more about how they feel about a vaccine and how to access. But in working through our group, we have a mass vaccination plan, and we've considered those who are really more at disadvantage and how we'll serve them. Just like we've done bringing influenza vaccine into communities or into locations where we know people feel more comfortable coming to receive the vaccine, who might not get out to some of the other locations, either because they're really not aware of where they are, or they don't have the transportation to get there, or it's just not someplace they feel comfortable going. So what we've been doing is working with our community organizations, in particular the cultural centers and our religious groups, to talk about how we can promote the vaccine when it becomes available. Of course, the big question is going to be, what is the vaccine going to be, and what group of individuals is it going to be the most effective for? Will it be our elderly? Or should we really be vaccinating our workforce that's going into the hospital, to the healthcare system, to their work, and who have children at home, so that we keep them healthy? So as we're learning more about the vaccine, we have a plan to provide that education out in the community and reach out to all our partners to make it a community effort.
Yeah, I think that's going to have to be a community effort, making sure people feel really comfortable and understand that obviously the pros, which we hope are most, but there's always questions about side effects, things like that, and being able to present them in a way that people feel comfortable and fully informed. One person asked me, speaking of the new vaccine, somebody asked me about the flu in the question, and they said, what is the connection between COVID-19 and the flu? I've never gotten a flu shot before. Why should I get one this year? It's kind of off our topic of health equity, but I think it's a great question. I know Pat can help us with that. Well,
If you've never gotten one before, I would advise you to make this your first year. We haven't, at least in my lifetime, and I'm pretty sure it won't happen again in my lifetime, at least I hope not, we haven't had a pandemic. So now we're coming up to flu season, and we still have COVID even at a higher rate in our community. The concerning thing is both have similar symptoms to each other. And with the flu vaccine, we know it does have preventative effects, either with preventative or lessening the impact of having influenza. With COVID, we really don't have those pharmaceuticals available to help us treat that. So it's really critical this year that more people really get that flu vaccine while we're waiting for the COVID vaccine.
Another question that we have is about the access to healthcare services in north of O Street. And, we've done mapping that shows that most of our health providers, at least our primary health providers, are located in Southeast Lincoln. We've worked really hard to try to create a different scenario. We have some clinics that are north, and more are coming. But I think what I would respond to that question, of Pat or Raju, you can certainly jump in. But I think the key is that we just keep working on it. It's slow. Putting up a clinic, building a hospital, all of these things are not things that happen overnight. Not only building them, financing them, but finding the kind of providers who want to work in an environment which perhaps has more low-income patients. And so our goal is to continue to do that. Our goal is to also address things like transportation to areas of the community where there are more primary care providers. And it is something that I also think is a messaging issue. When you are in a neighborhood West Lincoln or areas around Belmont where perhaps there are not healthcare providers or fitness clubs or hospitals that you see. It's a messaging issue, especially to children, about what's valuable to and what the community believes is valuable. So I think if not to plant services there, we have to work to plant health there in some form or fashion. We need to represent that as a value to every community. And while we can't, as I think President Obama said at one time, while we can't guarantee equal outcomes, we should be able to guarantee equal opportunity. And so that is, of course, always our goal to be able to do. We have another question for Pat about things are clearly worse now than back in March or April when the pandemic began, yet restaurants remain open. Do you foresee restaurants going back to takeout only again and not allowing dine-in services?
You know, last Friday when we spoke, we talked about some of the measures we were putting into place now based on what we've learned since the beginning of the pandemic. At this point, you know, everything is being considered if we don't start seeing the movement downward. And we will consider all kinds of options. The one thing I do know is we've made sure our restaurants in our community have had the 6-foot distancing and only 8 people in a party, and they have to be seated and wear their masks at the table. This is something that we've been fortunate to have in our community that other communities haven't. And of course, it's reduced the density in the restaurants. We're continuously evaluating bars, restaurants, what other activities can we look at that will reduce the spread of the virus. So I'm not saying that we are going to close restaurants, but I'm just trying to be very transparent that we're looking at anything that will reduce the spread in the community.
Well, back to the issue of health equity, I think one of the things we wanted to talk about is not only the adverse impact on people low income, but individuals of color as well. And one of the questions was about increasing cases of family dysfunction, perhaps abuse, child abuse, domestic violence, those kinds of things. I did talk to Chief Blymeister not too long ago, and he mentioned that there were growing rates of significant crime. A lot of it related to, my guess would be to some of the mental health issues, also related to the growing concern about the economics of this disease. And so I think what we will be seeing is that there's going to be different kinds of crime happening. And of course, my thoughts immediately go to the children in those families that are being affected, because we know the more that children are exposed to toxic stress, to adverse childhood experiences, and among them being witnesses or victims of abuse, being involved in the judicial or the law enforcement, having their parents or guardians be involved in the legal system, really causes disruptions in their brain wiring that lead to poor outcomes later in life. So I think we also have to be concerned about these ripple effects. And Pat, you mentioned one of those. You know, we can take our kids out of school, but then parents who have to stay home to educate their school lose their jobs. It also means that perhaps we take away from the healthcare workforce people like CNAs and nurses that have to come home to take care of their kids. But I also think that these growing mental health issues have ripple effects in the family, that kids are being exposed to more difficult circumstances, which will lead to worse outcomes later on. So my call is always to say, it's not as easy as just preventing an illness. This is creating a larger set of concerns for our community that we all need to respond to. So I don't know how you feel about that, but I do think the ripple effects are things we're going to be feeling for a long time.
You know, and Lori, I appreciate you saying that, because I often, you know, when we're making decisions here and looking at what's available, we're consulting both national and state and our local experts. We work with our physician consultant for the health department, and we look at best practices that are happening. But when we hear people say, well, we need to close the schools, or we should close this business or that business, we have to remember that people are employed there. They're dependent on that income to take home and take care of their families. And if they don't have a position where they have paid leave, or if they're in an environment that doesn't support that, it creates an additional stress on the family. And right now, there isn't really any federal or state resources for these individuals to be able to be at home and have some type of financial support in continuing to do that. So we have to look at all of those, just that ripple effect that happens when we make some decisions. So those are all the things that we carefully consider. Those are the things that keep me awake at night and worrying about where we're at and what we need to do. So it really is that community effort and really supporting what needs to be done. And I have seen tremendous outpouring in assistance given to address some of the inequities we have in our community, but we still have a long way to go. And I hope that we'll be able to move forward ahead with this information that we have now to make sustained differences.
Well, I am going to put, I have a couple more questions and then we're going to wrap it up. One is for me, it says, has CHE provided special funding for programs addressing COVID in the last 8 months? You know, one of the things that we did do is that we kind of pulled back from our funding of regular programs when COVID struck. And we really reached out to the community to ask where we could be of help. We did help the health department with the relocation of the homeless women and children from the mission. We provided resources that weren't quite ready to come in from the federal government, and even unusual things like if you were an agency that had to provide meals to go and suddenly you had the cost of providing to-go containers that weren't in your budget, we could step up and do those kinds of things. We did provide money to the COVID Relief Fund. We were one of the major contributors to that. And right now what we did is after a few months, we decided that our job was to get back into putting money in the community. And so we created a resiliency fund. And the resiliency fund was created specific with the idea of addressing COVID related issues, whether that be health equity issues, whether that be related to opportunities that they were seeing like telehealth or moving remotely to a set of services that people could access in that way. And so what we were able to do in those kinds of things was to really allow people to ask us for things that they felt were being impacted directly by the COVID epidemic. So just recently we approved a little over about $1.5 million over 3 years to be able to go to work on allowing agencies to provide online services, to reach out to elders who are in isolated living situations, in institutionalized care, who haven't seen their children or their families for maybe since March or April. And so we're looking for those opportunities to begin to build resilience back in the community. And we're hoping we're going to be able to do that. And I think we have one more question, and that is, it says, many minority groups are at higher risk for chronic disease like diabetes and high blood pressure. How do these chronic conditions impact the risks of COVID?
Any of those chronic conditions put individuals at much higher risk. And that's why it's really important that we assure that everyone has access to the level of care they need. And that's been one of the things that's been increasing concern to us even prior to COVID occurring. But we have seen more disparate outcomes for individuals with chronic diseases, especially if they're not as well controlled. So it has a tremendous impact.
Yeah. Well, I'm going to ask both you and Raju to answer a final question for me. And again, this is just putting you on the spot, so I apologize. But I think it would be good to know what is one thing. I mean, I know we've talked about wearing masks, we talked about distancing, we talked about washing our hands and all of those kinds of things. But is there any other thing that through this real just tumultuous period that you would want people to know about people who are growing weary of kind of feeling as if they're their activities are being limited, people who are growing weary of the isolation, people who believe that this may never end. What is something that you would want them to know, and especially related to creating a more equitable health outcomes for our entire community?
That's a lot of questions in one question, Laurie. Just
I'm
like
sorry.
you always do. Okay. I think like one thing that would definitely help us in addressing the spread right now is to limit your gatherings. Make it your own household gatherings. I mean, household, thing. I mean, close-knit community kind of things. That would really help. Apart from masking, washing hands, and everything. Yeah, that's limit the size of your gatherings as small as possible, if just for the immediate household, as much as possible.
And Lori, one of the things that we've been doing here and working with other groups is, since Medicaid expansion, which is insurance for individuals with low incomes, came into being here, we've been really working to make sure that individuals and families can access that. I think, of course, what Raju is saying is limit your gatherings, stay with your own household, but also try to see if you have a neighbor or a friend or somebody you know from your spiritual community that could maybe just reach out to them, send them a note, or offer to assist them in some way. I think it's really important and it's meaningful. I'm not in that position, but some days are really difficult, and it'll always be when I'll get a card when I'm worried about what we're doing and persevering. I'll get a card from someone saying how much the work we're doing here at the department is helping our community. So I think we need to do those same things with each other. When one of us is weary, reach out to the other and help them move through. See how you can help individuals. Are there things you can provide at the school so that students have some of the materials they need and can access the things that they need, maybe for their families? Consider all of those things. Donate to the food pantries. But make sure even giving gift cards to the school, I know, has been helpful, and we did some of that to allow people to access what they need on their own terms.
Well, and I'll answer the question too, just because I don't want to put those two on the spot to do that. But, one thing I always ask myself when we're in a position of having information in front of us is, what will we do now with what we now know? And I hope that what we have put in front of you is perhaps a little new information or a reinforcement of something you already knew. But the question is now, what do you do with that? What do you do now with what you now know? And I think Pat provided some great insight to that, but I think all of us have to understand that we have a role, whether it be in direct service to individuals, whether it be in healthcare, whether it be the great work of the public health folks, or it may be just reaching out to someone in our neighborhood, an isolated senior, a family that's been particularly hard hit because they've lost their job, a young girl who is talking about being suicidal. We all have a role to play in making sure that each other is okay. And that extends into our cultural community. That's maybe a part of this community that you're not familiar with, or that perhaps you aren't as comfortable entering. But I can tell you that it's as simple as helping a small business succeed, a small ethnic restaurant succeed. It's about working to make sure, like I think someone said in the videos, that we all are family. We're all occupying the same few square miles of dirt here in Lincoln. And so making sure that that's what's going to help us get through this and help us level the playing field. So I just want to thank Pat and Raju for joining us, the knowledge that you provide, the insight, not only to health equity, but to the COVID situation in general. I want to thank the folks at LNKTV, Melissa particularly, for all the work that she did to put this together, to Marsha White and in our office, who provided so much help to this as well. And to all of you who joined us today, I know that this was a lot of information, but I hope it helped you see a lot of faces of COVID, both the data and the stories together. We're going to be doing some more series on health equity as after the first of the year. I would encourage you to be part of those. You can find out more about those on our Facebook page or our website page as well. And this is also, you'll be able to replay this video. If you'd like to share it with anyone, you'll be able to get that information when it's over. So in the wise words of Pat Lopez, wear a mask, wash your hands, watch your distance, and stay well, everyone. Thank you so much.